Jamie Lees has seen the same GP for the past 6 years. But it wasn't until she took her newborn for a checkup that she discovered they had stopped bulk billing.
When I went to go leave, they told me that there was a cost, and I was quite shocked.
With appointments now costing up to $80,
Really?
she says her son's fortnightly visits add more pressure to the family budget.
It has been hard just because, groceries have even gone up, the price of living, and the fact that now it isn't bulk billed with doctors, it does make it a lot harder.
This practice has also moved away from bulk billing, claiming the model is unsustainable.
We're faced with a choice either of seeing increasingly more patients per hour to cover our overheads, or else passing costs on to the patient in the form of a gap payment.
However, there are concerns patients could suffer.
I worry about patients avoiding getting the help that they need or the tests that they need at an early stage and maybe having a worse clinical outcome. And I think the government needs to think very seriously about the role that funding has in that.
The WA government says the issue has increased pressure on already stretched emergency departments.
It's around the country, but it is particularly acute in Western Australia. And if you can't get access to a GP, you go to an emergency department. And that's what we're seeing here.
It's led to more calls for investment into general practice.
Primary care is the bedrock of the health system, and having a very, very strong primary care and a general practice care in a country will ultimately ensure that we've got a really healthy population.
The federal government has promised to deliver at least 50 bulk-billed urgent care medical centres across Australia. Tabarak Al-Jarood, ABC News.